In general, aside from the dental hygiene and brushing habits that we all pay attention to, there is another aspect of cleanliness that often goes unnoticed but actually deserves our attention. The oral environment is one of the most suitable places for bacterial formation. Here, not only do our teeth and gums play a role, but our tongue also has an impact. So, if you're wondering what extra care we need to take besides regular toothbrushing, tongue cleaning is very important for us. Actually, brushing every day is not really the right thing to do. But brushing our teeth every day is something we already do. That's a separate matter. However, we should clean our tongue every 2 or 3 days. One of the common misconceptions is brushing the surface of the tongue harshly with a regular toothbrush, just like brushing your teeth. On the surface of our tongue, we have papillae, which are responsible for our sense of taste and help the tissue there to heal. If we brush the surface of the tongue harshly, there is a possibility that we might damage the papillae on the tongue. There is also a risk of injuring the surface of the tongue. If you're wondering how we should actually do it, you can clean the tongue with a gentle sweeping motion, as if you're taking a swab, making only very light contact with the surface, not by pressing or using force, but with a soft brushing movement. As I mentioned though, the surface of the tongue is a bit more sensitive. If we try to clean our tongue every day or by pressing hard, there is a risk of damaging the papillae on our tongue. There is a possibility of wounds forming on the surface of the tongue. That's why every 2 or 3 days, especially for patients who smoke or drink a lot of tea and coffee, you'll notice it when you look in the mirror anyway. The tongue can become yellowish and there may be slight color changes. Therefore, it's better to brush the tongue after brushing your teeth, and you can stick your tongue out completely and brush its surface with a scraping motion.